Dr. Life's Joyful Remedies presents. How to get rid of dengue fever. Dengue fever is a mosquito-borne viral infection caused by the dengue virus, DENV, which is primarily transmitted by Aedes aegypti and Aedes albopictus mosquitoes. It is prevalent in tropical and subtropical regions around the world. In today's video, we will be exploring dengue fever, symptoms, treatment and prevention. Before we dive in, however, please tap the like button, subscribe and turn all notifications. Symptoms. Symptoms of dengue fever typically appear 4 to 10 days after being bitten by an infected mosquito and can include high fever. Sudden onset of high fever, often reaching 104 degrees Fahrenheit, 40 degrees Celsius. Severe headaches. Intense headaches, particularly behind the eyes, joint and muscle pain. Severe pain in joints and muscles, sometimes referred to as breakbone fever. Nausea and vomiting. Feeling nauseous or vomiting. Fatigue. Severe fatigue and weakness. Skin rash. A rash that may appear a few days after the fever starts, possibly spreading to most parts of the body. Mild bleeding. Symptoms may include easy bruising, bleeding gums, or a nosebleed. In some cases, dengue can progress to severe dengue hemorrhagic fever or dengue shock syndrome, which can be life-threatening. Symptoms of severe dengue include severe abdominal pain, persistent vomiting, rapid breathing, bleeding gums, fatigue, and restlessness. Causes. Dengue fever is caused by the dengue virus, which has 4 serotypes, DENV1, DENV2, DENV3, and DENV4. An individual can be infected by one serotype and can later be infected by another one, which increases the risk of severe disease. Transmission occurs mainly through mosquito bites, particularly from the Aedes mosquitoes, which breed in stagnant water and are often found in urban areas. Treatment. There is no specific antiviral treatment for dengue fever, but supportive care is essential. Treatment methods include hydration. Maintaining hydration is crucial. Oral rehydration solutions or intravenous fluid therapy may be needed, especially for severe cases. Pain relief. Over-the-counter pain relievers like acetaminophen, Tylenol, can be used to reduce fever and relieve pain. NSAIDs like ibuprofen and aspirin should be avoided, as they may increase the risk of bleeding. Monitoring. Close monitoring of patients for warning signs of severe dengue, especially during the critical phase, usually around 3 to 7 days after symptom onset. Rest. Adequate rest to help recovery. Prevention. While there is no specific vaccine for dengue in widespread use, a vaccine called Dengvaxia is available for certain populations. Preventive measures mainly include eliminating breeding sites, remove standing water where mosquitoes breed, using mosquito repellents, apply insect repellent on exposed skin, wearing protective clothing. Long sleeves and pants can help reduce mosquito bites. Installing screens. Use window screens to keep mosquitoes out of living areas. Vector control. Community efforts may involve fogging or spraying insecticides to control mosquito populations. If you suspect dengue fever or have specific concerns, it's important to consult a healthcare professional for proper diagnosis and management. The effect of controlling body electrolytes in the treatment of dengue fever. Controlling body electrolytes is an important aspect of managing dengue fever, particularly in patients who present with severe forms of the disease. Dengue can lead to significant changes in fluid distribution and electrolyte imbalances due to various factors, including fever, vomiting, and increased capillary permeability. importance of electrolyte management in dengue fever. Fluid loss. Dengue fever is often associated with high fever and gastrointestinal symptoms, nausea and vomiting, which can lead to dehydration. Dehydration alters electrolyte levels, particularly sodium and potassium, which are vital for many physiological functions. Hemorrhagic symptoms. In severe dengue, increased capillary permeability can lead to plasma leakage, resulting in hem concentration and potential hemorrhagic manifestations. Proper management of electrolytes can help mitigate these effects. Renal function. Electrolyte imbalances, particularly concerning sodium, potassium, and chloride, can impact renal function. AKI, acute kidney injury, may occur due to dehydration or severe dengue, necessitating careful monitoring and management of electrolytes. Nutritional support. Patients with dengue may also require dietary adjustments to replenish lost electrolytes and fluids. Intravenous. 4. Fluids may be administered to maintain hydration and correct imbalances. Monitoring and replacement. Electrolyte monitoring is crucial in dengue management, especially for those in a hospital setting. Electrolyte levels are typically checked regularly, with replacement performed as needed. This is essential to prevent complications such as cardiac disturbances, muscle weakness, and neurological issues. Treatment strategies. Rehydration. Patients with dengue often require rehydration with oral rehydration solutions, ORS, or 4 fluids containing appropriate electrolyte concentrations, for example, isotonic saline. This helps restore both fluid volume and electrolyte balance. Electrolyte solutions. Oral rehydration solutions may contain specific amounts of sodium and potassium to help replenish lost electrolytes, particularly in cases of vomiting and diarrhea. Thank you for watching. Please like, share and subscribe.